Good morning, guys. I hope we're all sparkly. Before you do anything else, stop the video, not right now, in a second, and like our new Instagram page, The Men's Health Clinic. There's going to be lots of exciting, fresh content. It isn't just going to be me talking about philosophy, about my ice baths. It's going to be about testosterone replacement therapy, and lots of exciting things that you can achieve by doing the right thing, microdosing TRT, the most effective way of achieving stable male androgen levels. Is it just testosterone, cypionate and HCG? Oh, all will be revealed. Is it just daily dosing? Because it's the most effective way of mimicking physiology. Well, actually, we have another methodology. So follow the page and you'll find out more. But it's not just about testosterone. It is about lifestyle. It is about mindset, what you can achieve. And we're always striving to be the best version of ourselves and earn our reward. This is a new exciting venture. And we've got Tyler Palmer, our cinematographer, who did our first 2 promo videos. He is amazing, and he's going to create something I can't create because I focus on what I focus on, because I am a medical doctor. My focus is what? You. I don't have time to be doing videos. I do these videos out of a necessity, really, but there's only so many times I can say earn your reward. So yeah, we have to evolve. Our clinical practice evolved from following the manufacturer guidelines, following the, yes, Nebido every 12 weeks, Testogel, apply that daily, you rub the cream and that, no. And it didn't work. So our methodology evolved into microdosing. Again, the premise behind any therapy should be to mimic physiology or correct a pathology that is messing around with physiology, which again is one of the reasons why we do not like finasteride. I feel okay on it. Really? But you're dysregulating the physiology. It makes no sense. We need to work with our physiology to improve our psychology, because our psychology is how we feel. No, emotions, that's how we feel. But should we be dictated by our emotions? No. We should understand the interplay between physiology and psychology and then allow our emotions to be positive. But it's all about choice, and consciousness adds an unnecessary complexity to this life. Now, we should be enjoying ourselves, but what are we doing? We're all struggling. Should you struggle? Yes, you should struggle. You should be going through hardship to come out the other side. But it's easy to turn to look into the abyss. But beware, the abyss will gaze back at you, Friedrich Nietzsche. So understand it, understand your shadow, but move forwards. Now, we as men like to move forwards, but with low testosterone, you can't move forwards. You're in this purgatory. Now, why are we wanting to move forwards? Because life is a journey and the destination is death. So you must appreciate every single moment and live in the moment, because that is all that matters. The past is the past. The future is the future. Live in this very moment and make the most out of every single situation. So yeah, journey. Now, what is it? Males versus females. Now, men are testosterone dominant. So we are reward driven because testosterone has this relationship with dopamine. Now, we obviously have estradiol because we have to be considered. But again, dopamine, reward, positive. Estradiol, serotonin, more of not a negative hormone, neurotransmitter, but it's a calming neurotransmitter. So what do we want to be when we're men? Both calm and determined to achieve our reward. Now, women are more estradiol dominant, which means they're calmer. Again, they're not the hunters. We're the hunters. But they also have testosterone, dopamine. Now, we share the same hormones, but we have different amounts and our genes express them in a different way. You can't turn a man into a woman and a woman into a man. But guys on testosterone replacement therapy can be a bit womanly. Now, why is that? Because of estradiol. So you can raise estradiol above the normal ratio of testosterone to estradiol. And that can make men feel pretty uncomfortable because we're not very good at dealing with our emotions, are we? Oh my word, because why? Men, testosterone, dopamine, logic driven. Take that away and what are we left with? Nothing. And that's uncomfortable. There are too many people struggling with mental health problems as a result of not understanding their physiology. There are too many men taking their lives as a result of low testosterone. The number of patients that have told me that they were suicidal prior to TRT, the number of patients we've successfully managed to get off of antidepressants is incredible. So do not underestimate the importance of testosterone and mental health. Testosterone, dopamine, reward, logic driven. Take that away and what have we got? Nothing. So we need that. We need that base. We need that chronicity. As we've said before, hormones, chemical messengers that help facilitate the function of their target organs. But they're fundamental to life. You are your hormones. Testosterone, dopamine, logic. I need that back to be a healthy human being to move forwards, because I need to do what? Yeah, I need to earn my reward. And when I can't earn my reward, I'm unhappy. Now, what happens? We said before, hormones, the base, testosterone, dopamine, reward, boom, go for it. Now, that's the base. Now, obviously, life's a little bit more complex than that. But Lydia hates it because I can medicalize absolutely anything. But the base of a pyramid is your hormones. Above that's your acute nervous system. And above that's your reactive brain. And then your consciousness adds this unnecessary level of complexity. But it's wonderful because it gives you choice. It gives you the ability to make the right choice. But it's ultimately down to you. Now, I am the king of self-destruction. When everything's going perfectly, I mess things up. Do I do it deliberately? Well, sometimes I do it deliberately, but not normally. Now, what happens? Well, I'm pushing because I'm on testosterone and I'm dopamine, reward driven. Go forth. Now you have to be considered, which is where the estradiol comes in, serotonin. So it's about, what's that word? That word is balance. It's about understanding the necessity for contrast to allow you to be considered. But ultimately, that conscious thought allows you to be in charge of your destiny, to take personal responsibility and accountability for your actions. And so, yeah, the king of self-destruction. Now, why is that? Because we live in this weird world. It's just so peculiar. Now, I absolutely love my job. I was asked the other day, what's my favorite part of my job? And I went, I'm going home. And that was a little bit of bravado, a little bit of male, whatever. But actually, I talk about it in the Instagram video. It's hopefully you'll be touched by it, because I was touched by it. There was actually a little tear, because I'm utterly amazed the impact that hormones can have on physical and psychological health and your emotions and your ability to move forwards. Yes, to take that necessary step, that next step on your journey, appreciating that the moment is all that matters. I am absolutely flabbergasted with the impact that hormones have on physical and psychological health. I had no idea, but they are the key. You are your hormones. But ultimately, consciousness allows you to be in charge. Now, with low testosterone, you feel pretty miserable. Why? Because your physiology is dysregulated. With normal testosterone, do you feel amazing? It's up to you. It's really your decision. Because it's obviously a little bit more complex than that, but you are an animal. So an animal does what it needs to do. What do you need to do? Find shelter, find food, have a bit of sex. And yeah, that's it. Very simple. So understand your principles, understand hormones, understand your autonomic nervous system, understand your reactive brain, understand that your past is a necessity and it's made you the person that you are. You are exactly where you need to be. Now, where is that? Here. You are living in paradise. This is the utopia that you have created. Ultimately, what happens next is down to you. So what sort of story are you going to write? Are you going to be the hero or are you going to be the villain? Now, we said in this previous video, it's about making the right decisions, and we self-sabotage because we need to find that danger. So actually, don't try and self-sabotage. Find something, hardship, that allows you to survive, which is why we like ice baths, why we like saunas, why we run the fan dance, why we do expeditions, because we're living life, we're experiencing life, and that's ultimately all it's about. Appreciating the moment. You're in charge. What are you going to do with it? Earn your reward.